The leaders you hear from tonight, led by their members, have successfully organized to support historic investments in mamas and working families. Our voices compelled this administration to pass the child tax credit and critical investments in our nation's physical infrastructure and the environment. Our call to action tonight is for our elected officials. For those of you who have championed legislation like the Voting Rights Act, paid leave, universal child care, and the child tax credit, thank you and keep fighting. We have your back. And for those of you who believe tax cuts for multi-billion-dollar corporations without any relief for families is significant and sufficient, you're about to learn just how strong a mother can be. Policies like the ones included in Build Back Better gradually withered and died in the Senate. This was the opportunity to finally make a down payment on the care infrastructure that our country so desperately is lacking. Over the last year, we've seen mamas and working families continue to keep their heads above water despite burdens exacerbated by COVID-19.
We need to protect women of color from the unconscionable maternal health crisis Black and brown mamas are forced to endure in this country. Research shows that Black women consistently receive lower quality health care than white women. Pregnant women need to feel safe going to the hospital, and women facing challenges of the pandemic must still be able to access healthcare services. Yet parents are feeling more vulnerable than ever.
The pandemic also brought to light the invisible labor that falls disproportionately on women. When schools turned to remote learning, it fell to the parents, but in reality, mostly moms and informal caregivers to take on the new role of homeschool teachers. And it was moms who were left to carry the heavy load of mental, emotional, and economic burdens too often on our own.
2 million women, highly qualified women, from janitors to CEOs, cannot return to work without affordable childcare. Families cannot afford the high cost of care, and they cannot find care when and where they need it. Beyond that, this women's work, performed overwhelmingly by women and disproportionately by women of color, remains undervalued and under-resourced. Providers earn low wages because the roots of caregiving are tied to slavery, when enslaved Black women were stripped of their right to mother their own children and forced to mother their master's children without pay. Later, childcare workers were left out of labor law protections.
64% of Black mothers are the primary or sole breadwinner for their families. The lack of affordable, accessible time to care and heal places Black families at risk. Furthermore, death rates for Black Americans are higher than white Americans when it comes to heart disease, stroke, cancer, asthma, flu, pneumonia, diabetes, HIV and AIDS, and homicide. Paid leave and paid sick days that allow people to take the time to care for themselves would help address racial health disparity.
We must look at healthcare, including reproductive health, not just as a women's issue, but an everyone issue. Black women should be respected enough to receive culturally competent, safe, high-quality healthcare, no matter their circumstances. We must have the body autonomy, resources, and opportunities that allow us, our families, and our communities to thrive and not just survive.
The time is now for sweeping legislative action to finally ensure mamas and working women receive the support they need and deserve.
Our current early learning system is unsustainable. Congress must pass a significant investment in caregiving and early learning to make our economy work for working families.
Lawmakers must also prioritize the passing of bills like Pregnancy Fairness Act to finally enshrine legal protection for pregnant women, and also pass the Schedules That Work Act and Part-Time Workers Bill of Rights to allow mamas to have more security in the workplace.
Far too many families cannot access or afford childcare. That's why the Senate must deliver on Build Back Better. We must also invest in supports for informal care providers, the unsung heroes of family, friends, and neighbors who we increasingly rely upon to help bridge the gap in meeting our families' caregiving needs.
Paid leave is essential. We as caregivers know that better than most. Yet Build Back Better negotiations saw investments in paid leave slashed from 12 weeks to 4 weeks. And members of the Senate suggested that even 4 weeks was undeserved. Our right to heal without the risk of financial devastation was but a joke. Lawmakers must pass and implement paid leave for all to preserve the health of all families. We can build the country we need, but it requires us to reject the patriarchal status quo that is rooted in racism, misogyny, and classism, and turn to each other to hold our elected officials accountable to the standards we deserve. Mamas deserve better.